Hello, everybody. Welcome to another webinar with Career Final Frontier. First of all, huge congratulations to all of y'all that might have just passed your exam. Y'all are new grads. Y'all just made it through the July boards, and we're all very proud of y'all. So huge congratulations. I think it's a step out of where you were unsure of how it's going to go, and now is a step forward towards how to make this better clinically. You've done everything you can, and I think it's all shown a great effect in passing your boards, getting through school, getting through those final preparation time, clinical rotations, and a lot more. And now from here on, we're here to support you as to what could happen clinically better on field, that you're ready to go in terms of going to your new job and your dream job and make it all worth. So let's start with our little presentation on how to effectively communicate. I would like to introduce all of our speakers today. Dr. Singh, that is the founder of Final Frontier. Derek, who's the managing partner and business manager for Final Frontier. Vidhi is me. We have Amanda, we have Katie, we have Christina, and we have Kay. These are all our speakers for today, and they all have their own special specialization, special interests that they have more knowledge with, and we've all combined all of our knowledge together to put forth some amazing things that will help you be able to communicate better, be able to be a better clinician. Let's try to see what we're going to gain or what we're going to achieve out of this webinar. At the end of this webinar, we're hoping for you to be able to better communicate, define what is communication, use effective communication in your practice. There are different types and ways in which you can communicate. So we're hoping to try to give you some strategies on how to do those better. We're trying to make you feel more confident with respect to how to communicate with not just your teammates or classmates that you have been, but now trying to communicate with different interprofessional individuals. Maybe you have to communicate with a doctor, with somebody you're giving interview to. So we're trying to get you strategies to how to communicate to all these places better, and implement actually those skills into be able to rock an interview that you're probably going to have soon. Let's try to first understand who are you, which describes you the best. And what we are going to do is we're going to try to have your answers in the chat just to find out where you're at in your preparation, who you are, what kind of settings you like, and then what your specialization is. So try to put there in the chat as to which of these suits you the best. Hi, Dr. Singh. Thank you for being here and supporting us.
Yes, I just want to see all of you and say hi. And I miss you in classes.
Can you all please reply in the chat which one of you, which of these options fit you the best for this question? This is not a trick question like Dr. Singh would ask in his class. This is easy. Great. We have a great mix of inpatient and outpatient. That's amazing. Good. Okay. So the good thing is that all your speakers have specialization, like I said, in different facilities when we've all put in all our knowledge together to be able to give you the best way to go about this. So that's we have speakers here that have been in the outpatient setting, that have been pelvic floor specialists or are pelvic floor specialists, that work for inpatient or acute care settings or have worked for acute care settings. And that is the beauty of this, that we're trying to bring you the most variation possible so that no matter what you're interested in, you will still be able to take benefit from this. Okay.
All righty. So another now not a trick question, just to gauge the room. So we are wondering, you can put it in the chat, coming into this webinar, so we'll get to ask this at the end as well too. So how confident are you in your communication skills? You have A, very confident in any situation. B, somewhat confident, depends on the situation. C, average. D, not very confident. And D, and E, no confidence. So we can throw them in the chat. And it's totally okay. Again, this is just to poll the room and just to see where we're getting started today. We hope by the end you'll be around A to B. Okay, awesome responses in the chat.
Okay, that's great. So let's start with that as to how do you define communication, right? It is simple. There is an exchange of information, and this exchange of information could be between different people, between you and your patient, between you and the person that's interviewing you, between you and your boss or your manager, between you and several other healthcare workers, with your teammates, with different people at your job, say someone that handles billing, someone that is a rehab tech. So to be able to effectively and more so confidently and clearly communicate with all these various individuals that you're about to be speaking with or about to be familiar with, we're trying to give you the best strategies and the best practices for those.
Hi, everyone. My name's Christina. So first, we're going to start by going over the main types of communication. There are 4 main types of communication, as you see here on the screen. There's verbal communication, which is done in a face-to-face conversation in person or is done virtually, like how we're talking to you all now. There's nonverbal communication, which we do even subconsciously, and it's something to be aware of when you're trying to engage with an audience. Be aware of your body language, the tone of voice that you're using, the clothing that you wear, your overall body posture, and your eye contact. Another type is written, which can be email, text message, handwritten letters, anything that's written down. And lastly is visual, which is using images such as graphs, charts, or pictures to help communicate your message. Next slide. So I found this really eloquent definition of effective communication online that I thought would be helpful to share with you all. It says effective communication is the process of exchanging ideas, thoughts, opinions, knowledge, and data so that the message is received and understood with clarity and purpose. So a way for you to make sure that you are being true to this definition is to remember the 5 C's that I've put here for you. Make sure that you are clear with what you're communicating, concise and to the point, correct in what you're saying, make it complete, like closed loop style communication, and be compassionate about the message that you're trying to deliver. To maximize your effectiveness in your communication, make sure that you consider the audience that you're interacting with. Practice active listening, because communication is a 2-way street. It's not just saying things to people and being understood. It's also seeking understanding, and make sure that you're choosing the proper delivery medium.
So like Christina said, right, you have to be able to effectively communicate. Now, effective communication, being clear, being concise. Now, all of this could be so many different things in terms of while you're communicating, and it could be different to how and who you're communicating with, right? Communication must be or could be as simple as you communicating with an HR during an application of the first job, what to say and what not to say to the person that is communicating with you. Now, say example, if there is a small company or if there is a mid-sized company that has reached out to you and they're trying to set up an interview, what are the questions, what are the things that you can ask the clinical person, or what are the things you can ask in HR? So you're supposed to know, you're supposed to have correct information, concise information about whom and what to communicate what with. Same thing in terms of foreign trained employees, right? Your most important communication sometimes could be explaining about your visa related support or explaining needing visa related support. And there are so many ups and downs that always happen. So to be able to correctly and concisely and in a complete manner have the best communication so that the person that is listening to you understands what you're trying to say, especially when it's a visa related situation, right? Then comes an opportunity or when it is the first day of work or with your patients. Now, like Christina said, right, the best thing about this is 2-way, so that you have to be an active listener. Now, this becomes very important when especially you're treating a patient or talking to your coworkers. The importance of actually listening to your patients can make a big change. So many times there have been complaints, or there still are complaints, where doctors, the place where they fall short is listening to the patient when they tell you about your complaint. So that your listening is a better or maybe most effective part of communication before you actually give out information. And again, information passing along, you want to make sure that it is the correct information that you're passing. Anything you say can be very effective to the patient, to the interviewee, to your employee, or anybody listening to you, because they take you as a sense of responsibility. You come from a sense of responsibility as to what you're saying. So your words are really taken very seriously. So you want to make sure that you're effectively communicating and communicating in the way that it will only help, or at least try to help the individual, instead of trying to give false information about something that you're not sure with. And we'll let you know how to communicate or how to go around in situations where you're unsure of.
And so that kind of brings us to virtual communication, right? So how are we doing this exactly throughout kind of virtual platforms? And so I think COVID brought a lot of that up for us. And the answer is the age-old, it depends. So it really depends on the situation, right? So when it comes to virtual communication, communicating with a coworker, again, keeping things really concise to the point. And so that's kind of like I am a coworker about, hey, like this is what is going on with my patient. Here are the 6 steps on how I, my plan of care, but also instilling trust, right? Your coworker is your peer. And so it's not you dictating what these things they should be doing, but really it is kind of like, let's open this conversation. This is the patient I'm relaying to you. I trust your skills as a PT. Here are the things I'm noticing. And that also needs to be reflected in your documentation. So virtual communication with your coworker, always form and write your notes with the mentality in mind of my coworker is going to read this, pick this up, and be able to treat that same patient. So communicating with a referring provider, virtual communications are emails, their faxes, things like that. And it kind of has that added layer of professionalism to them. So we're not, peer to peer, but I still trust you, but also establishing yourself as a physician as well. We'll kind of get into that in some of the upcoming slides. So for the referring provider, it really is, hit them with the knowledge first. So here is all of my objective findings, so they can understand, hey, I am an established professional. These are the things that I am understanding and seeing in my patient. And then here's my concern, right? So a lot of the times whether that concern is positive or negative, it's here are my reasons and here's what I'm thinking, not here's what I'm thinking and why. I find that it goes better the other way when you kind of be like, here are all my findings. This is what I deduced from them. So that way, the physician can kind of get the mindset themselves, of like, okay, these are all the symptoms that I noticed this patient is having. Here's where my brain is going. It's similar as if a patient was sitting in your office and they said like, oh, I have XYZ symptoms, instead of coming in and being like, oh, I have a spondy fracture, right? Because then that kind of, it feels like there's this difference. Whereas when you start that conversation with, okay, like I'm layering all the things, why I'm a professional, why I think this way, it kind of establishes again that layer of trust and professionalism. And the last is communicating to a patient virtually. And this is where, it's very important to be personable with your patients. It's very important to be, positive, and especially in the pelvic health space, being able to be very honest with them. But I find that virtual communications are best kept short and sweet, very to the point and concise. So sometimes keeping that line of communication very professional with patients in a virtual sense is really important for establishing that line, because they are seeing you more often than a doctor. A lot of the times PTs, the beauty of it is we don't have the stigma of being a doctor while still having the evidence and the trust with that patient. But still, kind of one of those boundaries to think about virtual communication is keeping things nice and short and sweet and being like, I noticed you have this problem, X, Y, and Z to fix it. Here's a resource. And then always kind of wrapping it up with a follow through for the patient of like, here's some things I can expect next visit. Here's some things we can continue to talk about next visit. You also don't have to fix all their problems in an email. They could hit you with 40 different things and you can be back. Those are excellent questions. I'm validating your concerns. These are things we will touch on. This is a great starting point for our session, right? That protects your boundary, that protects your energy and time when you could be documenting, and it gives them peace of mind of, okay, I'm not crazy. So those are always some really good key takeaways for that. And the biggest thing, proceed with confidence. You are the doctor, right? And so moving on to kind of communicating with yourself, I want you to do this exercise with me right now, right? Imagine your best friend. They're in front of you right now. How would you describe them? Right? Are they kind? Are they funny? Are they to the point? Are they fluffy and eating their feet next to you? Yes, you. So now, those same adjectives, how do you think your best friend would describe you? Would they say that you're smart? Would they say that you are brave? Would they say that you are compassionate? Is that how you describe yourself? It doesn't matter if you are the best physical therapist out there if you do not believe that yourself, right? You do not communicate with yourself that you are confident in the roles in which you are taking, even if it's the smallest thing, just one a day of I did that one thing well, right? That is what you need to take away is your communication starts with how you talk to yourself, because you cannot talk kindly to others if you don't start with it. And then, make your mantra. Is it something you say every day? Is it, I am kind, I am compassionate, I am leaving it here, make it yours, right? So take away from this webinar and go ahead and make a mantra. Or if you're me, you can make memes like the one you see on the screen. And for those of you who are listening or may not be able to see the screen, it is a bird screaming at himself in the mirror and with the caption, "You're going to pass all your finals, get your doctorate, and prove them all wrong," which was my mantra in PT school. And then it's the balance of interprofessional communication. So different kinds. And so I saw the K and I got confused. So I'm going to hop off.
It's okay. I was going to let you just go for it. Yeah, so this is just, if you were at any of our other webinars, I wanted to pull back that these all are cyclical, right? We're continuing to learn and grow, and present all the information to you, which is why these are great. But interprofessional collaboration, like Kay was just saying, is more than just to your PT peers, to the referring provider. Depends on the setting, but you might be talking to a variety of people, like social workers, nursing staff, prosthetists, if you're working with amputees, and all of that has these different levels of complexity in how you work with them, right? Depending on the situation. What I found is really helpful when you're dealing with a lot of different interprofessionals to help with that patient, to always just keep that patient goal in mind and that you are a team working towards that patient goal. But then also when you hire on to where you're working and the different people that you might be working closely with, is just really understanding like their ideal mode of communication, right? Some doctors prefer to have secure chat through Epic if you use Epic. Some prefer Teams, some prefer email, some prefer text. So just kind of knowing how people are going to respond best is going to get you a little bit further as well, and keeping that in mind.
So then we can talk about interdisciplinary communication, right? So this is helpful in all of the different settings because a patient has multiple people on their care team, and it goes outside of the scope of physical therapist to physical therapist, or communicating with an occupational therapist or a speech language pathologist. This is not an exhaustive list. It's just a list to get the conversation started about all the different ways that you are going to be asked to communicate with various team members. It can be when you're coming up with a discharge plan, when you have questions about medications, or you might have some suggestions on, how you want to manage tone or spasticity. Maybe you want to suggest a medication, or you want to get some more knowledge as to what their prescriber is giving them and why. You might have to teach their family how to handle them safely at home and how to do safeguarding, how to do stairs, how to get in and out of a car. You can have weekly team meetings depending on your setting. In the inpatient rehabilitation arena, you have a weekly meeting every single week that has a bunch of different people and specialties in it. You can do co-treats with other specialties, requesting orders from doctors, verifying precautions if people are post-surgical, what their status is. Is it safe for me to see them? Is it not safe for me to see them? If you're inpatient, outpatient, you can also do progress updates and send information to different doctors. Rapid response teams, you might have to communicate a situation that happened unexpectedly to a bunch of different people that all come at different times and want to hear the same story. So there's a lot of communication in this profession. So having confidence and being able to actively listen and get your message across in a cool, calm, collected manner is going to be something that's going to be beneficial in the long run.
So how do you reach out to the MD, right? what is the reaching out to the doctor or the medical professional or the referring provider part. Now, as my co-presenter said, that it is possible that you won't be able to make everybody better. You can't possibly make everyone better. So in those situations where there is an issue where you are not able to solve, or where you feel like, okay, your expertise alone is unable to help, that is when you find and when you try to triage. What is meaning triage? You find what order of treatment should this patient receive. And I feel like new grads, whenever I was starting out, the most thing I would be worried about, what if I can't make this patient better? What if I cannot provide the best treatment or figure out what to do with them? So in that situation, and in those situations that may arrive from time to time, you are best when you triage, when you find out a way as to how to help. Either you send that patient back to the doctor, the referring provider, and give them all the information on what you've tried, what your thoughts are, your written communication about where you think this is going, and what your deduction is from the evaluation and the treatments that you've done, or trying a more holistic approach with another care provider, say a chiropractor, trying to see if medication and PT helps, trying to see if injection and physical therapy helps. New evidences have found out that with frozen shoulder or adhesive capsulitis, a cortisone injection and physical therapy are both the best practices in earlier acute stages of frozen shoulder. So some things like this, and you may want to be responsible, you may want to be able to add this effective communication with the referring provider, with the doctors, so that you can effectively treat the patient. You alone sometimes are not able to make that patient better. And again, when you work in a setting where you have other providers, depending upon your OT, your speech therapists, you may want to include them. You may want to include specialties and see how effectively you all can work together to make that patient better. So that is what is called triaging, trying to find out how, if not just you, what entails in making that patient feel getting back better, getting back to their goals, and making sure that they progress effectively.
Alrighty, so now we're going to do a little bit of a case scenario question. Unlike the full life course or the study bundle, there's no true right answer. This is really just, again, to pull the room and get your guys thinking about what we've been talking about so far. So the question is, you are a physical therapist working in the outpatient setting and treating a 17-year-old 6-week post-operative left ACL reconstruction patient. Everyone's favorite, I know. The patient has not yet gained full extension on their surgical side. Which of the following forms of communication would be the next best step for you to take as the treating physical therapist? So again, we're going to have you put them in the chat just so we can see what would be your next step that you would take.
I promise you, we're not going out and telling anybody what you answered. So go ahead.
Yeah, it's okay. Anyone can throw one out there, or I can even start talking through the options as well too, like how I would handle this as a provider, which might give a little bit of insight. I'm gonna give you guys 10 more seconds.
Come on, we can see some answers there. Whatever you think is the
Some
best.
answer?
There you go.
All right, there we go.
Sometimes there isn't a right or a wrong answer. There could be things, and that's the beauty of it. This is not NPTEFF.
Exactly. We all can take our own way and our own street of how we would approach this. And each of us, like co-presenters, might take it a completely different route. So I guess how I think through each option is option A, texting the surgeon via the number given on the patient's protocol. In my mind, I would ultimately want to call the surgeon's office first, over texting them first. If this was the last resort I had to use, this might be the option I would use, but there's other ways that we could better approach this first. Option B, telling the patient's family to reach out to the surgeon with concerns would definitely be plausible. So let's say you're not able to get a hold of a surgeon, you're trying to call them, they're not responding back, but you know your patient's going to their appointment the next day or the next few days. That might be the best opportunity to get to the surgeon directly through them. Option C, we already discussed about before. And then option D, It's always good to continue to educate the patient on what they need to improve, what they need to work on, and make sure they understand why we're doing this and the importance of doing it. So D is always a viable option too, but to get directly to the surgeon, that again would not be the most direct route, but again, still important. So great work, everyone.
I'm back. Did you miss me? So now we're kind of moving into, okay, like how do I actually get a job to have these communication skills with and at? And it really does start with interview prep. And so how you first start that line of communication is really important on how the rest of kind of your career starts to pan and play. And again, really that confidence is key, even if it's a false sense of confidence. If you are reversing the imposter syndrome of like, I'm the best there ever was, that is exactly what you need to go into an interview with. And so starting with, you know, the basics of, do I need professional pants, right? Is this an online versus an in-person interview? Are they going to see me from the waist down? I don't know what any of your pants are wearing, except for the one guy that has his full body picture in the caption. But otherwise, you know, online, you're definitely going to want to practice. And that really is what comes with all of these. And so online, test your connection beforehand, call a friend, make sure your Wi-Fi is up to par, because there's nothing worse than being mid-interview and then, you know, puttering out, missing what somebody says, answering a question wrong because you didn't hear something fully. That really is what you're going to want to make sure online, make sure your lighting is good, test out different backgrounds in your house. You know, you don't want your messy laundry all behind you. So make sure you kind of have that neutral environment. And then if you're in person, don't wing the location, right? You're going to want to check out like, okay, my interview is at 2 o'clock. What's the traffic like during that time? What is, you know, do I know where the location is? Is it inside a building that I have to get up to the 6th floor that I don't know the map of the building? You know, you don't have to show up to the office and go in, but like prepare yourself for the vicinity, or at least give yourself enough time before the interview to make sure that you're not late. And now it's actually like prepping for the interview itself. List your strengths, and soft skills go really far. Everybody knows you're smart. You have a doctorate in physical therapy, but they want to know how you're going to benefit the team with the skills you have. So are you a leader? Are you really good at Microsoft Teams? Are you really good at collecting everyone's information in meetings and keeping detailed notes? I am not, but I love when people can give me those bullet points at the end, right? Start thinking about those things of like, actually, what do I do in group settings? What have I done in clinicals? What kind of things have been pointed out to me? What kind of things do I like about me? And then list your weaknesses, right? Are you disorganized? Are you, you know, are you quiet? You know, do you need a little bit extra time to think? How can you make them strengths? Not every weakness is going to be a strength, and that's why we have a team, right? You have people who can pick them up. Don't expect that you have to be everything for the place that you are going for. That's not the point of a team, right? The Olympic they didn't just win the gold medal because Simone Biles rocked her floor routine. They rocked it because Suni got on the bars, everything like that. It is a team effort. There are skills that one person has that someone might not, and they need to complement. So it's okay that you're not, they want to know that you have some weaknesses because they want to make sure that their team is balanced, right? And then we'll talk in kind of upcoming slides of like some examples of how to make them strengths. And really kind of make sure you know where you're interviewing. And this was kind of really touched on in the beginning, is like, make sure that you go onto their website and interview the interviewer. Make sure you know what's going on with their clinic. Maybe because it shows that you care, right? It shows that, okay, this person has taken an initiative and actually knows that we host classes on the side, or they do yoga, or we have a massage therapist, this and that, all of these things on the website. And pick topics, start the conversation that you know you can control, right? Oh, shoot. Okay, so that was supposed to, I had it animated, so now that picture is in the way. I don't know if there's a way we can get that out. But this is going back to the weaknesses. It's like a positive spin, and it's a meme of a guy moving a couch with a chair. And it's like, is it hard for you to just ask someone for help? And yeah, that can be hard for a lot of people. That can be a weakness. So I can sort of wing it from what I see here. But I can make a positive spin of this. So as we're kind of going through, some of the weaknesses, if you are, you can say that instead of, honing in on and focusing on small tasks, you're detail oriented, right? I have trouble saying no, right? I like to take on a lot of projects. I tend to be over enthusiastic. And a big team player, but sometimes I can take on too much. That's a great way of saying I have trouble saying no. Impatience, right? You can be, instead of I'm impatient, I'm enthusiastic to kind of move to other tasks. Requiring specifics, you can also be like, I really love a detailed plan. I'm working on trying to go with brevity. I'm trying to work on, as long as there is that kind of spin of like, I am this, but I'm also working on this, or I am this because of this, right? Managing missed deadlines. It's like, I'm really good at putting my all into projects, although sometimes that can go beyond the timeline allotted. I give a lot of detail. And then one that I think is, really kind of hones for a lot of us anxiety folk is receiving criticism. And I think that's a way for you to really show a lot of human in your interview of being like, I don't receive criticism well in this aspect, right? I don't receive criticism well when it's being told to my face, but I've done well in the past when it has been written in an email for me, right? You're setting the precedent of, yes, I'm going to work for you, but there's also this like mutual respect for one another of how I like to be communicated with as well. So I think that that's something to really improve on, is, again, like as Amanda just said in the chat, like look at weaknesses as areas of improvement, because you are not going to nor expected to be perfect as a new grad. And then really just the end is kind of, again, that confidence. So knowing your worth, again, you guys are really smart. You passed NPTE, you are doctors in physical therapy, you know what you're talking about. And when you don't, you're signing up for a team that is going to help you. So make sure that you're asking questions about the team as well, right? You're valuable in healthcare. They know it, you know it. And so the meme on this page is a frog looking into a mirror, and it says, "You're a star, baby." And it says me hyping myself up for my first interview after PT school. And this is kind of my final slide of tips and tricks, is really turning the interview onto them, right? So yes, you're being interviewed. They want to know your skills, but you want to know why they're a good fit for you. What, because they're taking equal stakes in hiring you as you are in being their employee. You're about to give a lot, over 50% of your day every day, regardless of weekends, is going to be this place. So you have stakes in them as well. So make sure it's something that's going to fit you, because again, you're a star. So this is some that I kind of pulled from. So I just moved from Chicago to Rhode Island. I just was at an amazing place for 2 years. But I moved because my partner started residency. And these were actually things that I asked in my interview. And so I copied and pasted them. And I want to know, what are the things you're seeing every day? Is there an opportunity for me to shadow other people? Because I'm 2 years out, but I still want to learn. I want to know how to do, an anal balloon expansion on a male patient, or what a vaginoplasty is going to look like for my pelvic floor patients. Things I might not have been able or exposed to a lot. Does my schedule allow for that? And also, do I get compensated for that? If it's a cash pay practice, how does that work when there's a co-treat going on, right? What kind of things does the team enjoy? Do you do things as a team? That's, the funny red flag people are going to say is like, oh, everybody's like family. I know a lot of toxic families, so we got to be careful with that analogy there, right? So knowing, what you guys like to do together to like really make that kind of a positive environment. And then, this one is, I loved this question that I asked, is like, would you describe your workplace as collaborative or independent? you know, what is expected from me? And you can be looking for one or the other or both, right? That is on you as a clinician. Some people work really well as a solo unit and kind of reach out as needed. Some people need that team environment to thrive. So being able to ask that and have that in your pocket, chef's kiss, right? And then know your benefits. Ask your benefits up straight. You talked about continuing education. What's in it for me? How much is that? Do you include an APTA membership in my, if not, that stuff you can also negotiate. Say you love this place, but you're like, man, I just can't, I want that $600 to go towards a dry needling course, but it's also can go to my APTA dues. Negotiate that. Be like, I would love to accept this position on the contrary that you guys also pay for my APTA membership for, you know, my employee, you know, moving forward. And this is one that I just think really shows the true colors of the clinic that you're working for. A lot of times, especially as you're looking at big overarching hiring managers who are managing multiple clinics, is can you share something about your team that you're proud of? And if they start talking about the people, huge green flag. If they start talking about the sole productivity, ask yourself, how much are they invested in me? And I think that that's something really important. And, you know, Anna asked about documentation. And I think you mean, and correct me if I'm wrong, you know, like what systems you use or your timeline for documentation. I think that that's fair. It's like, do you guys allow for time do you have dedicated admin time per week? Is that something I can get on my schedule? What is the timeline of when I start an eval? How long is it expected? Is it 48 hours? Is it 24 hours? Is it the end of the month? You are allowed to ask, what are my expectations as an employee? Chat monitors, did I miss any questions that came through? Cool. That's what I got.
Just adding to what Kay said, I think this was so brilliantly put forward. And I think that this makes a whole lot of difference because when you have questions that you prepare ahead of time to go and ask, it just makes you more confident to be able to go and walk into an interview instead of them sometimes asking you at the end of the interview, hey, do you have any questions for me? And you're left with not having anything to ask for. I would say, and I think we all would agree that it's always good to ask them questions and to know and clarify your doubts before you consider anything. Another good question would be as simple as, do you mind that, can I spend some time with the workers here and try to chat and talk to people? So that gives you a great idea when you're trying to actually talk to someone that works there or has been working there for a few months, for a few years. And that allowance itself says a lot. If they kind of hesitate with you going and chatting around with the staff that is on the floor at the time where you're in the interview, it would not make me comfortable. Why can't I talk to these people before I actually decide if I want to work here? So that's a big green flag. If that is an allowance, if they let you stay in the facility for as long as you'd like, if they let you talk to other co-workers, if they let you actually share or see their caseload, you're not breaking HIPAA and just trying to glance as to what their schedule looks like or what a particular day in that particular workplace looks like. So I think all of those are big green flags. And I think in terms of productivity, Anna, what we mean is like, what is the expectation in terms of caseload that you're supposed to see on a weekly basis? Is, like Kay said, is there time for documentation that they provide, like admin time for documentation? When do they need their documentation done? Is it 24 hours, 48 hours, monthly, whenever their expected time is for you to document? And on top of that, do you lose money if you don't see as many patients into productivity? There are so many, and let me tell you that again, so many places that will tell you your annual salary, but it only comes in later. That, okay, if you've not seen X amount of patients in a week, or if you've not seen X amount of patients in a month, that you don't get paid your salary because, oh, that was only for X amount of productivity. So I don't think that it is against the law, or it won't look good on your side to ask these questions ahead of time, as much as affecting your mental and your physical health after knowing that, after signing up or after agreeing to be an employee at this place. So please be wise and careful. Of course, there are better ways to ask this so that you don't offend anybody or you don't make a bad impact. But again, just to making sure that you are allowed to ask these very important questions while you're in an interview. So yes, interviewing the interviewer, which I think was a great slide, the most effective one. Thank you, Kay, for bringing that slide on.
All right, so we're just going to continue, with what Kay just said. I can confidently tell you that each of the skills we have talked about so far, I have used in my application for PT school, for my clinical rotation I had to apply for, and even the job that I currently work in now. The key one for me was mock interviewing, and that was super crucial. I did this with friends, I did this with family, I did this with my aunt, who is a rheumatologist. So I had that almost like mentor peer relationship, but also someone that I could trust with the responses that I was giving and would give me that honest feedback. You could ask a clinical instructor that you trusted, a mentor that you had in the program. If there's a individual in PT school who is the year older, who's been through this before. I mean, any trusted individual that you're able to mock interview with will just make each time you go into an interview, make it feel that much more comfortable. Like Kay said, like prepping your answers to those generic questions, like your strengths, your weaknesses. And I had thrown in the chat too, like the way that I looked at my weaknesses was that areas of improvement. We all are not perfect. We're not robots. And that's the beauty of being humans and working with humans. So it's important to remember that your weaknesses aren't weaknesses, they're just areas of growth. And having that explanation and meaningful relevance is so key, because employers don't want to hear the answers they get from every single person. They want to meet you. The key thing that I always like to remember, share your story, explain who you are and like the how of why you got there, not the why or the what. It's about the how and just explaining who you are. All right, next one. And then we have another poll kind of style question to gauge the room now that we're at the end of the webinar. So we would like to know, you can put these in the chat. Again, no wrong answer. We learned a lot tonight from all of my co-presenters. And so which of the following interview prep tips are you most looking forward to using in your next interview? So we talked about taking a test drive if you're in person, or even testing your connection online if not in person. Doing a mock interview like I had discussed with friends, family, or mentors. Having questions for the interviewers themselves, like Kay talked about before. Or D, have your strengths, weaknesses, areas of growth, and most commonly asked interview questions ready to go. Lots of C. I agree. I was just going to say, if I was in this webinar right now, that presenting C would be the answer that I would say. Kay, that slide was amazing. If I was on the other side, love it. All right, I agree, Dr. Singh. I pick A. That would be perfect too. All great responses in the chat. This is awesome.
And that brings us to the last part of our webinar, where if you all have any questions, we're here to support those questions to be able to best answer them. Make sure that you're signed up and attending the next part of this series, which is happening on Wednesday, the 7th of August. And we're going to understand more about the CPT codes, what is insurances, and how they can be a little pain sometimes. And then what is prognosis? How do you best do prognosis and understand all of these together? So we're going to stick around here for a little bit. Kay has shared her handle, so please go follow her on Instagram. I have listed some of the services that we provide, and we can help in different ways. Thank you, Dr. Singh. Yes, you can definitely share your resumes with us to make sure that we can, if there's anything that we can do to help, we have great partners across the nation. And we only do partnership with employers that we trust in. So we know that our students are being placed and being given forward to great employers, and that will support all of this that we actually went on through this webinar today. If you're looking for any other help in terms of mentorship, in terms of different parts, and in terms of writing a resume, trying to do some interview strategies, that you can sign up for that.
I actually went through the process myself as part of moving to Rhode Island. Career Final Frontier had an opening. They set it all up. It was literally seamless. They took my resume, they sent it to the recruiters, they reached out to me, and within a week I had an interview set up. And I was able to kind of utilize all these skills. So really know that it is a resource out there for you, and we're all rooting for you. And as someone who's used the service, it was literally seamless.
Thank you. Yes, these meetings are recorded. What we will do is once both the part of the series are over, we will send over the recordings with the slides to everybody that registered.